It's Tuesday, August 11. This is the news on PBCJ. I'm Simone Absalom. 8 new confirmed cases of COVID-19 were identified in the last 24 hours. These bring the island's tally of cases to 1,031. The Health Ministry says 4 of the new cases were imported from Nicaragua and 2 from the USA. The other 2 are in Kingston and St. Andrew and are under investigation. Meanwhile, active cases are now at 213, while recoveries remain at 745. Of the 382 imported cases, 59 patients have returned to their countries of origin. The Office of the Prime Minister has implemented protocols consistent with COVID-19 guidelines and has moved to temporarily suspend operations at one of its buildings on the property due to a suspected case of COVID-19. Out of an abundance of caution, the Permanent Secretary in the OPM, Mrs. Audrey Sowell, has advised that the building in question will be closed today for deep cleaning activities. The building in question houses limited clerical office operations at the OPM and is not heavily trafficked or frequented by staff or visitors. The building is not linked to the executive building, which poses no exposure to the Prime Minister. Today's activities are being conducted in keeping with protocols set out as a preemptive measure to address any suspected case of the virus. Monday marked the first of 3 shopping days per week allowed by the government to residents of Church Corner, Bamboo River and areas of Summit, which were placed under lockdown on Independence Day because of a number of confirmed novel coronavirus cases. Minister of Health and Wellness, Dr. Christopher TUFTON, paid a visit to the areas under quarantine in the parish of St. Thomas on the weekend. Our reporter Melvin Pennant tagged along and filed this report.
The authorities saw an uptick in cases in the parish of St. Thomas starting from July 31. The team had been in that area working when a particular case led to the discovery of 5 cases, which were confirmed a few days later. The numbers have been increasing since then.
Yes, we're the team on the ground in keeping with the surveillance focus, because we have shifted significantly the approach to COVID now from border restrictions, even though there are still some restrictions at the border, and screening, which still remains at the border, to a greater emphasis on surveillance in the communities. And I want to begin by commending the public health team in the parish of St. Thomas and by extension in the region, because it is as a result of the surveillance that we do that has led to us picking up these spikes, if you will, in cases. St. Thomas is not the only parish. There are other parishes. You don't hear about them unless there is a quarantining of a community. But wherever we notice anything unusual, the team goes in and they assess and they determine. The truth is, over time, we're going to have more of this kind of intervention as part of isolating the problem if we think the problem is, and dealing with it decisively to cauterize it.
The quarantine boundaries start at the intersection of Morant River and the Bustamante Bridge and continues to where Stony Gut Avenue and Paul Place intersect. The boundary covers Summit Road and Summit Grove. Member of Parliament for St. Thomas Eastern, Dr. FENTON Ferguson, has no problem with the quarantine, but he is concerned about access to commodities and survival of small businesses.
I think if we are able to persuade the persons in the area and the business persons in conforming, and the public education that will take place, I believe it can be orderly. And it would serve many persons better if you didn't have to go into Morant Bay proper, if you are able to get it from small shops. But if you lock it down, or if by virtue of action persons decide to close, then it means that business will be impacted too, because many of the persons who are operating here, they live in the area. They are not just visiting. They might be living in, but have their businesses on the front. And so it is important how we manage the area, and that is why I will be vigilant in my own pursuit.
The MP also had questions about COVID-19 test results.
The turnaround time, I heard a question asked about how long it will possibly take once the testing is done. And I think it's important for us to know the turnaround time for the testing. Because while you are waiting, persons are, if they are positive, they are also infecting. In spite of what we are saying about doing all the other things. We have persons who are not following protocol and moving around. And so we want to ensure that they are in a position.
The Health Minister, Dr. Christopher TUFTON, responded commending Dr. Ferguson for his efforts in the community, but said residents have their own role to play.
He clearly has maintained an important interest in what's happening here for obvious reasons. He's a member of parliament. And I think we can work together, appeal to the citizens, and I know he will join me in that, so that they appreciate the importance of their role. A lot of these spikes that we see, frankly speaking, could be avoided if citizens play their part in observing the protocols, the wearing of the mask, the sanitizing, and those who come in from overseas observe the stay at home, isolate from family members until the 14 days. And very importantly, if they have symptoms, they must report it.
The quarantine will last for 14 days, at the end of which the Health Ministry will assess the situation and inform the public. Melvin Pennant, PBCJ News.
The Jamaica Chamber of Commerce, JCC, wants tougher consequences for COVID-19 rule breakers, including shutting down non-compliant businesses and arresting persons. The call comes against the background of 4 recent COVID-19 related deaths and the spike in cases up to Sunday, fearing the country could be headed to severe restrictions. JCC President Lloyd Distant says the authorities must strictly enforce current orders. Prime Minister Andrew Holness is urging churches to behave responsibly as the island comes to grips with the COVID-19 pandemic.
You would have heard what transpired during this week, where we have had outbreaks in 2 parishes, and we are now seeing cases generally spread that can be traced back to congregations. So the government has decided that we will have to specifically prohibit conventions and crusades. It is not something that I wanted, but we cannot afford a repeat. Now, if those errant places of worship had simply followed the protocols, if, first of all, those members who were ill, if they did what? Or as we say in Jamaica, simple, that's a simple measure. If the man of God who is ordained to preach, when he came back, or she came back, when that person came back from overseas, if they followed the quarantine order, then this wouldn't happen.
With a second wave of infections spreading across the island, some have speculated about new lockdown measures. Mr. Holness said, however, he's unwilling at this time to drop restriction on churches.
I am very reluctant to place regulations on the church because I believe that the church has the ability and the moral duty to regulate themselves. And I believe the church has been doing a very good job on this. Most of the churches, especially the larger established churches that I have interacted with, they have been proactive. They are not waiting on the government. They have decided to take steps even over and above what the government has put in place.
The Prime Minister urged the following of regulations and health protocols as outlined by the government. He was speaking at the Lucy Seventh-day Adventist Church over the weekend. Jamaicans who are planning to cast their votes in the impending general elections are being urged to wear masks on Election Day. Director of Elections Glasspool Brown says that those in breach will not be turned away from polling stations. Instead, Electoral Office of Jamaica workers may have to issue masks to ensure voter compliance. A COVID-19 clean team has been assigned to ensure that electors sanitize before dipping their fingers in the ink on Election Day. The ink is alcohol-based. Mr. Brown says the sanitization team will also be enforcing other safety rules given the COVID-19 pandemic. The EOJ and the Ministry of Health and Wellness have signed off on a COVID-19 protocol that is expected to help safeguard the health of citizens on both Nomination Day and Election Day. The protocols were ratified more than 2 weeks ago. And the Newland community in St. Thomas now has a potable water system.
We now, as residents of this community, has to play our part. We are long overdue of this system, and it has finally arrived. And I just want to say to the entire NWC, thanks.
Member of Parliament James Robertson says that the implementation of the water system is one of several developmental plans for his constituency and the parish of St. Thomas.
All the cussing, bad road water we left behind, all the things that have been said, we are going to see St. Thomas and our constituency, West St. Thomas, be the place to be. The place where everybody wants to come and enjoy the views, the climate, and our atmosphere, our culture. I want to say, as Member of Parliament, it brings tears to my eyes. And maybe I will have to use this towel that I brought here for others to wipe my own tears. Thank you.
Health Minister Dr. Christopher TUFTON says the development is timely as the country rises to the challenges being faced due to the pandemic.
A big part of COVID, which is my message now, is the extent to which we sanitize and we rid ourselves of the possibility of transmitting the virus. And the virus is very contagious. It easily moves from one person to the next. You can pick it up off a surface because of droplets. You cough or sneeze on this hardwood and somebody touch it with them hand, and then you go touch your friend, or you touch the masks or handle it badly without washing your hand, and all of a sudden you pick up the virus. So the basic message is that water is life for the people of Newland, but water will also allow you to protect yourself against COVID.
Operations have resumed at the Jamaica Fire Brigade headquarters on Hagley Park Road in Kingston after being closed on the weekend due to a member of staff testing positive for COVID-19. Public Relations Officer at the Fire Brigade, Emilio Ebanks, says the case, which involves a firefighter, was confirmed last week and deep cleaning was conducted at the building. He says the Ministry of Health was called in to do their contact tracing. Persons who needed to be quarantined and tested have done so. And it's time now for the latest financial updates. We go to the business report with Gabriel Thompson.
In Monday's trading session, the JSE Combined Index advanced by 955 points to close at under 400,000 units. Overall market activity resulted from trading in 79 stocks, of which 40 advanced, 30 declined, and 9 traded firm. The Junior Market Index advanced by 3 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Barita Investments, and Blue Park Group Limited. Stocks declined for 1834 Investments, AMG Packaging and Paper Company, and Berger Paints Jamaica. Trading firm were Siboney Group, Grace Kennedy Limited, and Jetcom Corporation Limited. Wigton Wind Farm Limited ordinary shares was the volume leader with 6.7 million units, followed by QWI Investments Limited with 1.6 million units, and Trans Jamaican Highway Limited with just over 1 million units. Now for the foreign exchange. The US dollar on Monday, August 10 ended trading at $149.09. The Canadian dollar sold for an average $112.55. The pound sterling traded for $194.86, and the euro ended trading at $177.07. Crude oil prices rose on Tuesday, underpinned by expectations of a U.S. stimulus to help jumpstart the world's biggest oil consumer, a rebound in Asian demand as economies reopen, and a stronger stock market. Brent crude futures gained 29 cents to $45.28 a barrel. West Texas Intermediate crude futures rose 38 cents to $42.32 a barrel. That's it for the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, People's National Movement (PNM) has won the general elections in Trinidad and Tobago. Prime Minister Dr. Keith Rowley on Monday night announced that the PNM had won 22 of the 41 seats at stake in the elections.
It has not been an easy task. It has not been an easy way. But the PNM has stayed the course. And once again, we have been called to provide the people of Trinidad and Tobago with the good governance that it expects from the People's National Movement. So far, as the results are in, there are one or two areas that need to be tidied up, but it appears as though we went in with 23 seats and we would come out with 22. A majority is 21. Thank you for that support.
The Elections and Boundaries Commission has so far not made any preliminary or official announcement of the elections.
Given the course that we have traveled, given the obstacles that we had to overcome in the period 2015 to 2020, I tonight want to say that this result confirms my faith in the people of Trinidad and Tobago, because I've always said to you that the people of Trinidad and Tobago can be trusted to do the right thing when they're called upon so to do. And tonight, you have done so today, as reflected in these results.
The other major party in the contest, the United National Congress, has won 19 seats. That's according to Mr. Rowley's statement. The Pan American Health Organization, PAHO, and the World Health Organization's Regional Director for the Americas held an information session on the rapidly evolving situation of COVID-19 in the region of the Americas and PAHO's response to the COVID-19 pandemic this morning. Here's a quick look at what was said.
Remains under the grip of COVID-19. But the virus isn't the only threat to people's health. The pandemic is also disrupting our ability to control transmission of other infectious diseases, many of which we have been fighting to eliminate for decades. The Americas has always been at the forefront of the elimination of infectious diseases. Indeed, preventing and treating these diseases was the impetus for creating the Pan American Health Organization nearly 120 years ago. We know that in some countries, infectious diseases such as dengue and malaria place a huge burden on health services. And along with many neglected tropical diseases, they have a disproportionate impact on poor and vulnerable populations, including our indigenous communities, much like COVID-19. In October last year, PAHO's member states committed to a region-wide approach for the elimination of more than 30 communicable diseases and related conditions in the Americas by 2030. The progress to achieving this milestone is now under threat due to the burden of COVID-19 on health systems and the disruption of essential services, including priority disease control programs, elimination initiatives, and routine immunization. Services for common conditions like TB, HIV, and hepatitis are being affected. Over 80% of the countries in Latin America and the Caribbean are reporting challenges in the delivery of TB tuberculosis treatment. If patients skip doses or interrupt their treatment,
Guyana's President Arfan Ali has met with his counterpart Surinamese Chan Santoki. We get more in this report from InfoHub's Anara Khan.
During a media briefing, President Ali indicated that the engagement between the two heads of state was extensive, covering multiple sectors, and was aimed at strengthening the existing relationship Guyana and Suriname share. The talks also focused on opening up emerging sectors and infrastructural link that can create opportunities for the two countries.
We recognize that our countries share similar challenges, circumstances, and opportunities at this moment. And it is very critical and important for us to work together to find common solutions, to collaborate, and to support each other in tackling the challenges, whilst at the same time confronting the opportunities that both countries and the people of both countries can benefit from.
He emphasized the need for time-bound objectives and disclosed that the framework has been laid. Echoing similar sentiments, President Santoki noted that the bond between the two nations is strong and that will form the foundation for future development. He added that cooperation will not only be at government level, but will include the private sector.
That cooperation will be on a very high level, on the level of the two presidents. The second one will be that this cooperation will not be a government cooperation only. Government should facilitate, and they should facilitate the private sector. So there will be an increased private sector cooperation between the two communities.
Both heads of state maintained that the bilateral engagement was not just discussions and promises, as a proactive action plan is scheduled to be produced within the coming weeks. For InfoHub, Anara Khan.
The Barbados Health Ministry is requesting the medical history of the 95 Ghanaian nurses that arrived in that country recently after one of the nurses tested positive for malaria.
The Ministry of Health requested the medical history of all the 95 Ghanaian nurses who arrived in Barbados 11 days ago. That's according to Acting Chief Medical Officer Dr. Kenneth George, who revealed that the information received by the ministry at that time was okay. He made the comments yesterday, moments after announcing that one of the nurses had tested positive for malaria.
We got good information on their medical history, and what was given was at the time okay to the Ministry of Health. The other thing I will say is that we, with respect to the nursing fraternity and the doctors fraternity, we don't put any exclusion. So for example, I don't say that if you had malaria you can't be a nurse. I can't say that if you had COVID, you can't enter the workforce at another point in time. I can't say that based on, even if we know a person's HIV status, that we can say and make a determination. So we got to be careful how we approach this. We can't put new roadblocks, which we don't do for our population. And I think we should stick to that at this point in time.
Dr. George said, based on the advice of Dr. Corey Ford, head of infectious diseases at the Queen Elizabeth Hospital, the remaining 94 Ghanaian nurses would now be tested for malaria.
We are fortunate to have a good team, and that advice has been taken, so we are proceeding along this, that all persons will be tested for malaria.
In sports, President of the Intersecondary Schools Sports Association, ISSA, Keith Wellington, says that he expects to get a decision soon on whether schools will be able to resume football training and start the new schoolboy football season by mid-September. ISSA said on Friday that it is continuing to engage stakeholders on the possibility of resuming competition as planned for October, but it has not received any written confirmation. The association says its executive is mindful of the range of issues relating to the spread of COVID-19 and the inherent risks involved in students engaging in training and competition, but it says that it continues to put things in place for the resumption of competition whenever it is safe to do so. And that's the news on PBCJ. Thank you so much for watching. Do remember to keep safe.